Madam Chair, you can call the meeting to order.
Yes, it is 9:03. Who is taking minutes? Thank you again. We will call the meeting to order. The Southern Berkshire Public Health Collaborative. If you're not speaking, please mute your microphone. The first item is the minutes of December 10, which Jim sent out. Are there any comments or corrections to those minutes? If not, I would entertain a motion to approve them.
Motion to approve.
Thank you. A second?
Second.
Thank you, Jim. Moved and seconded to approve the minutes of December 10. Any further discussion? If not, please raise your hand for an aye. We're all visible here. Great, thank you, unanimous. The updates, which I will turn over to those who have the primary information on it. Jim, intermunicipal agreement and the next steps.
Sure. Thank you, Madam Chair. So if the board recalls the last meeting, we had that big presentation from Cheryl, and we were going to have a discussion that we were going to sort of come back one more time to see if there's any tweaks from this board at this level, and then come to an agreement to start disseminating that out. So what I've been working on is, so the town of Monterey actually sent it to their legal counsel already, which is KP Law, which is one of the attorney firms that actually helped draft the intermunicipal agreement for the new shared services programs. And so they came back with a couple pieces of feedback. There was no issues per se. They felt it was a really good intermunicipal agreement draft. It's a standard format. They just had questions like, well, it's a 3-year grant, so when you come up with the appointees and the boards and the delegates, they should be like a 3-year term, and all little things that we're going to sort out as the IMA goes along. But in general, they were okay with that. I did reformat the intermunicipal agreement a little bit, and I sent that out the other day. If the folks recall, they want like contact person emails for all the individual towns. I put most of that in there of what I know. There is a few blanks in there, but I'll work with Jane to circle back with those specific towns on who they want for a contact. And then what I'm still working on bringing people into. And so one of the things that I also did to make it a little bit easier to navigate once we start moving this thing around, rather than just have one document with 15 signatures, because each town can be signing different things. What I've done is I put the individual town select board and board of health on one signature, and then the host community, which is Lee, and the tri-town board on one. So the goal is I'm going to move this forward to the town of Lee on February 1st to give a formal presentation. And the hope would be to, once Lee gives their blessing and they sign off on it and we get those master signatures, I'll then send them out to the individual towns for formal signature. But I think if there's no objections, if people want to move that to their select board and town council for review, at least to see if there's any comments, we can inventory all those and then make a decision on formal signatures. So again, I'm going to be moving it to Lee on February 1st. But if people want to engage their town councils, at least initially with this draft, to see if there's any preliminary comments, concerns, I guess we could do that for the sake of moving it along.
I hope we can do that, because I've already done it. I sent it to our select board and asked if there was, any concerns about it. I don't know, and I need to follow up whether they have done anything with it.
Yeah.
But I did pass it along with the, I think I also sent the presentation that Savara had done for us as background. Any questions on that topic for Jim, or any suggestions that would counter what he's thinking of doing? Good. Okay. Thank you. Jane, can you both take notes and talk to us on the FDA update? You're muted.
You know, there are these little pads, it's like Zoom bingo, where one of the things is you're muted, and so everyone gets a different one, and then, yeah, anyway, doesn't matter.
Okay.
So the FDA updates, I reached out to Steve Natras, who is our FDA specialist for I think it's Connecticut, New Hampshire, and New York, possibly. And so he said that they are meeting, I believe, on the 22nd, and that they will have decisions made at the beginning of February. He did sound very favorable about what we're trying to do in Southern Berkshire County. So, you know, we really don't have any reason to expect that we won't receive the grant. Again, there's a lot of awareness and excitement about what we're trying to do down here. So, so hopefully by the next meeting, we'll have those answers for the towns of Sheffield and New Marlborough. So there is quite a bit of like individual goals for those towns. And so once we get approval for that grant, anything moving forward that fits into those boxes can be used and reimbursed from the grant. So
Right.
it's exciting, and hopefully we'll have some forward motion here soon.
Well, it's nice to see all the work that you put into it, possibly coming to fruition on the benefit of many of us.
Sorry about that.
About what?
Oh, hi
Being
Scott,
late.
nice to see you.
Okay. Oh, being late.
It was way too simple, Jim. I just couldn't figure it out.
Okay.
And this is Juniper. We're babysitting this dog, and I have to return her today, and I'm after a month, and I'm so sad about it.
Okay.
I'll reflect that in the minutes.
Yeah, right, we'll miss her as well. Okay. The listserv update while you're not on mute here.
So I'm so sorry. I don't know what to do about this dog. So as far as a listserv, I've been working on, I actually have a good basis of what I'd like to put. And if you remember, we decided that we were going to try to go ahead with a shared folder being available to towns, so that, you know, with all of the relevant topics, with some draft letters and, you know, the regulations. So it's kind of a one-stop shop if you have a topic. I think a lot of us are good at certain topics. Like Scott probably could recite Title V in his sleep, you know. Jim probably could hold a hearing in his head for housing court. But we have a lot of like weird topics that come up, and then some of us have more experience with different things as others. So what I did is I looked at there's three main
Platforms.
programs that we could use. So one is OneDrive. So those of us who have a IBM or a computer or use Microsoft, that would be one option. There's also Dropbox, which was one of the first file sharing, and then there was Google Docs. So after doing some research, well, I wanted to ask you guys what you use in your towns. So like I know Tri-Town, for instance, uses Microsoft. And so Alford uses Microsoft. What do you know what you guys use as far as like, do you use Google or?
If I can speak for a moment for Sheffield, I don't know that we use anything, frankly. I personally use Microsoft for some other work that I do, so I know about OneDrive. But I'm not aware of any shared platform used by the town. I could be wrong, and I'll investigate that.
Yeah, I think that most of them are using Outlook. I'm sorry, Ellie.
My experience is that most of the things that I am getting from other people is Google Docs. OneDrive works as long as everybody you're dealing with is like tied into that. But when you get stuff from outside, especially if they're using Apple, Google Docs seems to work better. And I'm getting more and more of those from the state.
Yeah. The thing about Google Docs is that go ahead, Jim.
Oh, sorry. Go ahead, Jane. I'll speak after you're talking. It's about Google Docs.
I didn't say it was my favorite.
well, Google Docs is hard. I don't like Google Docs, but maybe I just don't know how to use it. I've been using OneDrive for most of my things for a while, and I'm happy with it. But again, when you go between a business and a personal computer, sometimes that is difficult. And so that's kind of where we're at. I think the next steps for me will be to just starting in February, I'm going to be hooked into Tri-Town. And so I'm sure that they have a lot of resources that they would be able to share for the towns. And so really most of my effort has been building those folders right now. But I'm in those folders every day, and I hope that is helpful for other people as well.
Jim?
Yeah, my only follow-up with Google Docs is I think when we first started the collaborative, there's a bunch of the board members that we had trouble getting them access to some of the Google. Remember, Pat, you and I went back and forth like 100 times. I mean, I put all these emails in, I gave everyone edit access. And so I just think we want to think about maybe 2 options to make it accessible for the membership towns. We can try Google Docs, then we can try to figure out, those challenges for those people that are struggling with that. We can also try Dropbox too. I mean, I use Dropbox sometimes with like really large files that I can't transfer, but whatever platform we use, I just want to make sure it's accessible on a variety of platforms for each town, because every town is, we use Microsoft, but like everything in the office is networked through a shared folder, but it's not accessible outside of that network. So that wouldn't be helpful for the Southern Berkshire towns. We just got to figure out a way so it's accessible for everybody. And if that takes a couple different ways, and I have tons of files too over the years, housing court, cease and desist. I have tons of stuff that we can help share, fee schedules. Pat and I were working on that the other day. There's so much out there that we can all pull in, and I just want to make sure it's accessible. It's accessible for all towns.
Ellie?
My one other comment about Microsoft, though, is keep in mind that with Windows 11, a lot of people with older laptops are going to have to buy new ones in order to have Windows 11. So that's, I open things all the time and say, thank you, Microsoft, for screwing this up again. And again, as Jim said, that maybe more than one platform. It's not a problem for me to save things to different, to put in 3 versions or 2 versions so that people can choose what they want. I mean, I don't know how complicated that gets.
Amy and I had talked about possibly working on our website some. And, that's the other option is that we could have a link to a file on the website so that would be accessible for anyone. So we're still kind of looking at that, but I think it's going to be a great resource. We just have to figure out a little bit.
Yeah, I use it on a Macintosh platform, OneDrive, and have never had any problem with that. So I don't know about upgrading the software and what that may do. I don't know. Okay. Any other comments about the shared information resource and however we deploy it?
Well, and I'll talk to our IT folks. We have a contract through Tri-Town. We have IT support, and I'll see if they know of any other platforms that is user friendly for file sharing, and I'll work on that next week.
Okay, thank you, Jim. I think the next topic is yours, the work plan status.
Yeah, for some reason, I don't know why that's on there, but we just wrapped up the second quarter. We have an existing work plan that the DPH has approved, and I'll be reporting on the goings on for the second quarter. It's still in place. There's no changes to that. Part of the work plan, and I'll bring it next meeting, is there's a status in there for each section of the work plan. Is it has not yet started, in progress, completed, and as we move along with Jane and the shared services coordinator, we'll keep up to date on that with the DPH. But I don't really have anything to report. We're moving along on everything in the work plan. The IMA, the logo's coming up. We're still moving towards becoming a vaccine provider. So everything's on task on what we're doing. There's no I think the heaviest lift is going to be the navigation of the IMA. But once that's done in the next few months, we'll just really be focused on everything else. And as we get through this rough patch, once again, with the public health nurses, we've already had a discussion the other day about regrouping on seeing what towns are looking for. What does Sheffield want in public health nursing? What does New Marlborough want? It's so chaotic right now, but we will get to that place where we start to really frame out what are the needs and wants and gaps in each of these communities.
Right, great, thank you. Under community collaboration, there was the first, was it the first, I guess, a joint meeting between the Alliance and the Collaborative. It was the second one, okay, between the Alliance and the Collaborative. Very productive discussions, very open, cordial, informative. And I know the report last night from the Alliance board was exactly the same thing, looking forward to continuing that relationship and continuing the information sharing. So I don't know if, Jim, you have anything to add to that?
No, it's great. I know we committed to 3 months. We're in our second month. It's been going really well, and we'll see where that goes. It's just, as time goes on and when these grants start to come up, the goal is to really be able to communicate and collaborate to see what makes sense for everybody in the county as we move
Right.
forward. And I think we're accomplishing that.
Right. The next item is the Rural Vaccine Equity Collaborative Update. There are 3 rural equity grants in the state, North, Central, and South. The one in the South is held by the by BHS.
Fairview.
By Fairview and the Rural Health Network. And they are in discussion, I think, in all 3 of those as to how to collaborate and not divide the work, but combine the work and make it to the benefit of the entire county. Jim, if you had anything to add.
Well, Amy was working with Deb Phillips on the proposal, and we helped do that. They're going to be the host, and we don't really know what we're going to do. I mean, there's conversation about, are there going to be dollars for the shared services coordinator to push out this, the work plan in the communities? There's questions on, can this funding be used to purchase vaccine? Can it be used to purchase equipment? So we're nowhere near that yet. I think the last email I got from Deb was, we're going to try to convene a collaborative meeting of sorts to start to think about what the next steps are. So we're really excited. I think it's really needed, especially the rural communities in South County. So that's all I have for now. And, Amy worked really hard in the middle of all the other crazy stuff to get a proposal work to Deb. And it sounds like, all 3 sections of the county will be doing similar work, hopefully.
Right, they're looking, the statement last night was one of the things they're looking is what the barriers were to health equity, to vaccine equity, that it's sort of a little late to correct them, but if we can understand what they were going forward, it'll help us prevent that discrimination in the future. Okay, D, SS, oh, the school update, sorry. Jim.
Yeah, so we've been meeting with the Southern Berkshire Regional School District. There's 5 or 6 towns in South County that send their students, Sheffield, Alford, Mount Washington, New Marlborough, Monterey, and maybe missing one. And so we've been meeting monthly for a while with Amy and Jill to really build those relationships, show support, kind of show the snapshots of what we're seeing in the county. And those meetings have been going well. So through all that, there's, I don't know, Pat, I don't know if you want to talk about this, but the school committee sent out a letter early on to the 5 or 6 towns, asking them, in Egremont too, asking them to weigh in to see if the boards would entertain a vaccine mandate. As the chair sent out a quick email response saying, if whoever qualifies for vaccine should take it, but it's really up to the boards of health to make that decision. I know Monterey had discussed it too, and so And I know there was a school committee meeting, I think December 15th, and conversations kind of ensued at the school committee level, basically saying, they're disappointed in the boards of health, that the boards of health should be doing this. And so there was that kind of going on. And, there seems to be this push about mandating vaccines. And the other day, Madam Chair, I mean, you were part of that email. I kind of replied back to Beth, and I, one of the things that we want to talk to Beth about, and I think we're meeting in the next week or so
Yes,
to have our conversations. And I wanted to really emphasize the role and responsibility of the collaborative per se, because I think there's some confusion out there. I don't know if there's confusion, maybe some interpretation that, we got this 10-town collaborative now, which is intended to build better public health systems, public health nursing, and whatever that looks like in the future. But we're not the policy drivers on behalf of the boards of health. The boards of health are still the boards of health, and they hold total jurisdiction when it comes to policies. And same thing for, the role of Amy and Jill. They're doing outstanding work. And if they want to go to a meeting, if they're asked to go to a meeting to look at numbers, see what the trends are, what's the data on the drive-through testing, I think it's great. And Amy and Jill have worked in the schools as well. When they were short-staffed on pool testing, Jill went down there and worked. So I think there's a role for us, but we're not the policy makers to be pushing specific statements or policies for the school committee to adopt. That still lies with the boards of health. The second
nor are we the scapegoat for their lack of action and coordination. So it is a confusing situation, and I think that they have become more hopeful and misinformed about what the role of this board is, and the complications of addressing the individual boards of health, which, as Jim said recently, who knows if they even have jurisdiction at a facility that's in Sheffield and their board of health is in New Marlborough or wherever.
So to add to that, since we have a lot of board of health members on here, is something that I've been thinking about and talking with certain towns on, like Pat said, and what I said in the email. It gets really sticky because we have this regional school district with multiple towns, multiple boards of health. It's physically in Sheffield. Can Monterey mandate a vaccine requirement in a school that's not even in their jurisdiction? And then it gets really complicated. The second piece is, even if a board of health was going to mandate, the enforcement component is the board of health. What's the board of health going to do? Start issuing violation letters to teachers in schools and making people leave school, and the school committee is going to give up their authority to give it to the board of health? It's not as easy as some people on that board think, that we can just wave a magic wand and issue a mandate for vaccinations, which, by the way, their percent vaccinations in the elementary grades is quite low. I don't know where it was now, but it was riding in the mid 40% the last time we spoke with Beth. So you have a large percent, for whatever reason, that's not this platform to debate this today. There's a large percent where parents aren't electing to get their kids vaccinated. So that's a big pill to swallow when you have a very large percent that they don't want a vaccine, and then we're going to start to mandate. I just think we just need to encourage vaccinations, continue to educate, and keep moving along. And I just don't think the towns are in a position to mandate a vaccine at this stage of the game. And
Right, and I think our role on that advisory committee is to make clear what the relationship is and the responsibilities are between the collaborative and the school district administration and the education commission, or whatever the heck it's called, committee. So we will take that on and report back and try and untangle this and maintain good working relationship that we've had, actually. The next item is the Southern Berkshire Opioid Working Group update. Who is discussing? Jane is discussing that. Okay.
That's me as well. Thank you, Pat. And so starting the beginning of next month, I think it's the first Monday of every month, the Southern Berkshire opioid task force meets. And that was something that actually Great Barrington, Fairview, and Railroad Street Youth Project started several years ago, back before we could ever imagine we were going to have a treatment center and that our first responders would be carrying naloxone. And so it's a nice group in that it really focuses on like specific gaps and works towards filling those gaps with some community leaders in Southern Berkshire County. So we have a contract with Railroad Street Youth Project, which got a federal grant to, you know, one of their work plan items was to continue the work of this working group. Rebecca's part of that working group as well. And just kind of continue the work of the committee. So we're very excited about it. And it's floundered a little bit through COVID. It's been hard keeping momentum and focus. And so hopefully we'll have some very concrete goals and I'll be able to report back out in the future, you know, things that we're actually working on actively.
Jane, how does this interface with that effort to have the needle exchange and opioid support group that some towns, including Sheffield, recently signed and it has in effect now? Is there a relationship between those two objectives? That came.
Oh, you mean both? Yes, I know what you're talking about. So yes, what's her name, Rebecca? It's Sarah. Is it Sarah DeJesus?
Yes.
And she's been going to those meetings. So in an answer, they're sitting at the table. They're part of the conversation. And one of the things that we hope to bring from the collaborative, so the Southern Berkshire Public Health Collaborative, is that link with towns to help further that work. So like, for instance, I recently got an email from Sarah asking, now will Alford sign the harm reduction letter that includes them being able to bring in services like a needle exchange and wound care.
Right.
And so they're kind of going throughout the county. So I would say we're this group, when I report out, if they have a specific ask, then this is kind of a link to the physical towns that will be valuable for them.
Great.
Other than
Good.
Jane,
Yes.
question. Is Deb Phillips with you on that group?
Mhm.
Yeah, okay.
Yep. Pretty much anyone you could think of, both everyone that you can think of that's kind of been working in South County is at that group. It's a collaborative and inclusive group. Did I see Rebecca's hand?
Yeah, I was just going to add, in regards to the needle exchange topic, if Sarah DeJesus hasn't said at your meetings or she hasn't come to one of your meetings yet to request that your town sign on to that letter to get a needle exchange in your town, I think the intention of having all of the South County towns sign that letter to get a needle exchange is really to have a mobile unit able to travel from town to town. It's not that there would be a physical needle exchange in every single South County town or Berkshire County town. It's just to have access to a mobile exchange unit.
Right. And I understand that they have just recently purchased that van. So they're moving forward on that project. Great. Thank you.
Were there any other questions on that?
Jim, sorry. Thank you.
Yeah, so Tri-Town signed on to that too. So it'll be interesting to see where the gaps would be as we move along, you know, as that comes to fruition. So that'd be really helpful too. And I think it's really needed, especially in the rural towns where people can't get access to support and programs.
Right. I did not find it difficult in Sheffield at all. I talked with the police department, the fire department, and that was it. They were all completely on board. So it worked very well. Yes, Ellie.
Yeah, we weren't quite as successful. There was a bizarre amount of reaction to the Stop the Stigma signs that somebody put up without asking anybody. So people are, this appears to be a bit of a touch stone in the town. So hopefully we will be able to address this. Stressing that it's a mobile unit that could come up. The questions were, well, that stigmatizes anybody who's showing up because it's too small, and they're better off going to Great Barrington. And I uncharacteristically shut my mouth. But I have to say, in really tiny places, their arguments were not unheard. So I'm just putting that out there for people to think about, that, it's one thing to have a mobile van, and that's a great idea. But if everybody knows your car when you pull up, I don't know. And I don't know what the answer is. More access is better no matter what, as far as I'm concerned, but clearly I am not in the majority.
Great.
Well,
Any
so
other?
to answer that, like Ellie, we in Alford, there was a couple residents that also were upset about the Stop the Stigma, and in that group of people that were there, it really started a great conversation around it's good that we're talking. If nothing else, it got us talking about it. And access for people who need clean needles, even diabetics. Like, it's not necessarily just people who are like active users or struggling with drug addiction. It's beyond that. And so these conversations that we're having that are really tough are just part of the process. In fact, I remember the first time it was mentioned, Rebecca, I think I was at that meeting when they first came years ago. And just in a matter of 3 years, I think the conversations have changed around that, like understanding what harm reduction is. So it's good that they had the conversation, and that's like the first step towards talking about it.
Ellie?
Jane is exactly right. I think that initial like pushing back, like that uncomfortableness of like, this is not in my community, is very normal. And I think, Jane's right, it happened in Great Barrington. You just have to kind of get over that hump, and then, you can really start to push forward with this.
Ellie?
One of the questions that I had was, would they also be able to take the injector pens? One of the problems that we have is getting rid of these needles and the injector pens. So if that group could be expanded to people being able to bring their used injector pens, so that they don't have to drive to Pittsfield to do it, which is the only place we can do it right now, that would go a very big way. They're not, they're one-time use syringes.
Mhm.
And that is a big issue, because for a lot of your diabetics and a lot of people who are on other injectable medications, that's how they're doing them now. But we can't get rid of the damn things. So what happens is that they bring them to the transfer station, and that's not working, because we're not set up for that. But anyway.
Jim, did you have your hand up?
Yeah, just a couple points on this subject. So regarding Ellie's challenges, I think as we build resources for this program, it may not be in all 10 towns yet, but if we can get 8 of the 10 or 9 of the 10, at least it adds accessibility for those residents. And then we can keep working together and learning and helping these towns understand the stigma approach to that. So I think, I wouldn't lose sleep over it. Just, we can continue to work as a collab. Now we have this nice collaborative. There's so many things we can tackle together rather than one person doing it by themselves. And I think we'll just keep adding to those conversations. And the second point, to Ellie's point about, no pun, about Sharps collection. Now, I have been working for years, exhausting myself, trying to figure out a South County Sharps collection program, even for just Tri-Town. It's always been a challenge. But I think we should put that in the parking lot and have those discussions when we get back to peacetime, because I think now we have this collaborative. I think we may be more positioned than we think to explore that program in the future, because now we can get more towns to kind of, the biggest issue is that I went through was Stericycle and these other groups that it takes a lot of resources for them to come and do a pickup at Tri-Town, for example, because we wouldn't have the volume, or it's like super expensive. And I think we should think about this later down the road. We have enough on our plate to maybe look at, similar to the household hazardous waste program. If towns really want to think about a sharps collection, we will be ready to explore those options further down the road. Just not today, but it is, there's definitely a need.
Yeah, what I find interesting is that, and I'm pretty sure this is correct, that there's a sharps disposal box, red box in the lobby of the police department in Sheffield. And I paid a
Oh,
fee
in
to have it
Sheffield?
collected. Well, it's somewhere in Sheffield because there's a fee for getting it collected, which
Oh, interesting, because they took it out of Great Barrington.
well, it's hidden somewhere and I'm paying a fee to have it emptied. So we
I
need to
think
figure
that
that
might
out.
be right. I know that they do collect, I think there is a collection box in there. Yeah, there's something, and maybe the conversation could be around, again, with getting information out is, getting out to the public, someone in Mount Washington, where they can drop off their
Right.
sharps.
Right,
Yeah.
good.
I think at the Sheffield Police Department, it's a medication drop, because when I was at Berkshire School
Right.
and it was the end of the year,
Right.
we
it's
had
not
bring
sharp.
expired meds there.
Yeah.
Yeah, I don't think it was sharps. I think it's meds.
This was,
Fairview has one in their
There's
lobby.
definitely a medicine drop there. I know because
Yeah.
I've used it as well. But somewhere, I have to follow up and find out where this, and see this. Rebecca?
this was over a year and a half, 2 years ago, but maybe try checking in with the health department, because I remember hearing that the Sheffield Health Department had the sharps disposal kiosk.
There is no health department.
Okay, somewhere in town hall then.
Ellie?
Yeah, and again, you cannot bring them to Fairview. You cannot bring them to your doctor's office. You cannot bring them, and that's my thought, was that if this mobile unit has to get rid of sharps anyway,
Mhm.
2 piles of sharps is better than 1 pile of sharps, and it's gonna make it cheaper in the long run. So hopefully they'll come up with that. But it was a viable discussion anyway.
I'll bring that up at the next meeting. Thank you for the input on that. That was
Thank
good.
you.
That was good conversation.
Great, terrific.
And Jane, my last thought on that, without belaboring this, like our household hazardous waste program encapsulates basically all of Southern Berkshire. We have like 7 or 18 towns, and Sandusville is actually part of it now, finally. While the vendor won't collect sharps, we should think about that in the future, about if we can get a vendor to tackle that, to see if that's an opportunity. It's something to think about for the group.
Yeah.
Great, thank you. Moving on to this absolutely contorted topic of home test kits. On again, off again, possible, not possible. I think that the Regional Planning Council has decided with the Alliance not to purchase kits. Am I correct?
Yes. Well, based
Okay.
on a conversation yesterday I had.
Right, that too many towns decided to wait and see what the government was going to do. And that even though they had originally committed, including Sheffield, to a number of kits, that now that number fell below a viable number, which is a pallet in the manufacturer that they were talking to. I think they are now not going to order any. Jim, do you have any other information?
Yeah, and I can add some clarity to all this, how this all shook out, because there's a lot of confusion with these at-home test kits versus the Binax Now drive-through clinics that we're hosting in Southern Berkshire County. And I know there's a couple of people from the public participating in this meeting. And so, like, if everyone remembers, before the holidays, the governor purchased all these at-home test kits and then disseminated them out to specific communities. They had their own plan of disseminating that out. And then shortly thereafter, we started the drive-through clinics, which are, hats off to that to everyone participating in that. It's going really well, and we're solving a significant need in Southern Berkshire County. And so there's confusion, not so much confusion, but people think we're showing up the first 1 or 2 of them and say, "Where's my free kits?" We're like, no, this is a specific thing. So then shortly thereafter, the governor comes out with this announcement, which was sent to like every select board in the Commonwealth, saying, "Hey, we just negotiated a lower cost. go on to Combis, and if towns want to purchase these at-home kits at a discount, go for it. So then we all started scrambling. So I was getting calls from town managers, administrators, some of the collaborative towns. And so I sent out an email to the Southern Berkshire Collaborative saying, hey, I'm going to look into this if towns are interested. I'm talking with Rebecca and Scott and everyone else saying, hey, Tri-Town may do a bulk purchase ourselves. Well, we spent 2.5 weeks going through our vendors, and they're like,
Yeah,
we'll put you
not
on a
happening.
waiting list. So then Sandra sent out an email saying that they're going to try to do it. So then I circled back with Sandra and I'm like, have you guys been successful? Because I would really like to know who you're going through, whatever price, because I can't get anything. And we have existing contracts and accounts with these vendors. And so I did put in an order for 2,000. We're in the queue. And then, so all these towns are scrambling with that. And then we find out that the governor purchased $26 million worth. So in essence, we're competing with our own governor on a mass order.
And he
So,
bought them all.
and all I can say is what I've been communicating, at least for our town, is like, look at, we're getting the Buy Next Now test kits. We're committed to another 2 weeks of drive-throughs. And then we'll see what's going to happen after that, because the weather's not our friend right now. It's getting harder and harder. Maybe we get to the end of January and things start to settle down a little bit. But these at-home test kits are very expensive. What we're going to do, purchase $30,000 and give them out to the public, and then they're gone in 2 days. Like,
Right.
what are we really gaining by this? And then other information came out by DPH and the governor pushing more people towards at-home kits versus the PCR. So it's like, there's so much going on. It's just, I don't know. It's just, so that's my clarifying point. There's so much going on between the free kits and the at-home and then the drive-throughs. It's just like, we want to get people tested that really need to be tested, not just for the sake of doing it weekly. I mean, we're getting requests from certain towns in Southern Berkshire, like, well, we want to do at-home test kits weekly for all staff. We're like, why? That's a wasted resource. You shouldn't do that.
Right. In Sheffield, our approach was going to be, and would still be if we get kits, that it would be crisis management, that when a town facility had an outbreak, that you really went in there with the kits and the families of these people, or close contacts, whatever. No, not the close contact, the families. But not to hand them out to the public. We could not figure out an equitable way to do that that made any sense whatsoever. So we'll see what happens, but don't hold your breath on that one, I think.
Jim, have you heard what's happening at a federal level? Because I mean, admittedly, I just caught a clip of something last night where the Postal Service is going to start sending out kits.
Well, the insurance companies are now mandated to
pay for them.
Pay for them up to 8
Right.
kits a month, I think it is.
So
But-
if you request it, or if somebody.
Well, or apparently if you hand them your receipt, so to speak, for kits that you have bought within the relevant, as of the 15th of this month, that they should reimburse you, but they may choose to provide you with something different than what you really want. I don't know.
All right.
I think the
Okay.
basic
Confusion.
issue that you've got here is that there are so many people who think they know what's going on, that nobody knows what's going on. And, it really led into deeper conversations, just like our needle exchange thing. What does the town do when they have employees who refuse to get vaxxed? And how does that tie into a policy of testing? And these are all, these are deep conversations for the municipalities or any business. I mean, if you're a regular business, you can decide what you want to do. If you're a municipality, you don't get that. So this is we've just told people we have no idea, and when they are available, if they are available, we'll let them know. And it's very sad because the government really, this whole thing of test before you go to a party, the message in my mind should have really been think before you go to a party. And, it doesn't do any good to know that you're not really not exposed before you go if you don't test when you come back. So I don't know. It was pretty much of a political debacle as far as I'm
Yep.
concerned. And
Great.
people are settling down a little bit more now, and their doctors are being a little more assertive about, no, you have to have a PCR test.
Okay.
Hopefully that will settle it.
Moving into another aspect of this, perhaps Amy or Jill would talk about the results of the drive-through testing.
Hey guys, can you hear me okay?
Yes?
Yeah. Yeah, so the drive-through testing, Jim asked me just to report numbers. We've tested around 1,080 people over the course of 9 clinics that we've offered so far. We have 4 left to go. Out of those 1,080 people, we've had 112 positives show up. And, you know, it was, I think we remember we saw our first positive at the first clinic. There was 1 that day. We're like, oh, we found a positive. The next day there were 2, and the next day I think there were 16, and then it went up from there. So, you know, it just kind of mirrored what we've seen happening in the community. We've gotten some really great feedback from those who've attended those clinics. And, you know, I really just want to take a moment to thank Pat for being, you know, so responsive when I first proposed that maybe Sheffield would be a good site, and Jim, when I proposed Lee. You know, we were thinking about where the current testing resources were located in the county and South County, and recognizing that, you know, for a variety of reasons, it could be difficult for folks, not only the shortage of, you know, the limited number of tests that were available at other sites, but also where things were and timing of things, and maybe we could add to the resource. So I'm really grateful we were able to get a significant number of tests from the Department of Public Health that are allocated to local boards of health. So, you know, on behalf of the collaborative, we were able to get more than any one individual local board of health could get at a time. And that's what allowed us to run these clinics for the whole community. So it's been a good experience, very exhausting, but, you know, we've had some great volunteer help, and now we're getting some MRC volunteer help. So we've got it in us for a couple more weeks, and then I think we'll be shutting down because we have seen a ramp up of PCR testing availability, and that's been wonderful just in the last week. And I think that they're ramped up and ready to continue as we get to peak and then start to head back down with the Omicron cases. So.
Thank you, Amy. 2 additional comments. We've been doing an unofficial research project to see how many people close their eyes when you do the swab as opposed to keeping their eyes open. That's kidding. But I will say that in almost all cases, the first thing that happens when they roll down the windows is to express their gratitude to the group that is standing out there in the cold and the whole effort to provide this kind of testing service. So Amy and Jill, congratulations. It's been a great success. Good. Any other comments? Jim, your hand is up.
Yeah, again, I don't want to belabor it, but I just want to really thank everyone involved, and even those that aren't working, supporting and pushing the message out there. It's just, I was really worried Tuesday. We had really challenging temperatures, and, you know, Amy and Jill put out asks to the community boards. People donated heaters and propane, and it's just hats off to the collaborative. You know, this is exactly what we're looking to do for public health programming in South County to fill a really important need. And for the most part, we've had really, really good feedback. And I want to just share one story. When we worked the first clinic and we were still trying to figure out how we're setting people up and whatnot, this older gentleman was in the line, and he was actually in tears, crying that he didn't have internet, he didn't have a cell phone, he was trying to figure it out. So like in real time, we pulled him over, registered him, got him into the walk-in section, put him back in line. And that's the real stuff that I really enjoy doing in public health, is just really helping people out, rather than just say, hey, you didn't register, come back another day. You know, we all just step up to help each other out, to really do things in our community. And those are the things that I enjoy doing. And I'm just so glad that we're doing this stuff. It's not easy. And I want to thank Amy and Jill and others for really, and Jane and Pat and many others for stepping up. And Jill is the she's a celebrity now. They got a picture of Jill in her hat and her N95 that the Eagle seems to be using for every COVID story now. So Jill, if things don't work out in public health nursing, you can be a celebrity somewhere down the road.
The poster
No,
child.
thank you.
Great, good, thank you. Moving on, all of you received, and I hope you looked at the logos that have been prepared and that Rebecca and Jim and I have looked at, debated, asked for tweaks in. Thank you, Jim. And so we'd like to present to the board today 2 ideas and get a sense, perhaps a vote even, on where you think, what one you think is best representative of the Southern Berkshire Public Health Collaborative. We went through quite a number of options and a few iterations, and this is where we stand now. I'm happy to open the floor to comments. There are 2 quite distinctly different. We don't intend on using them both. We would choose either the heart one or the hand, the one on the left, the tree. So please let us know your comments.
So while people are reviewing this, I did set up a poll, but I'll put it up in a few minutes if those want to do it's not a binding vote, just to get a sense of what people are thinking. So, we talked about number 1 is sort of like the hands kind of supporting the tree. Number 3 is a little bit different. It's more of a people tree trunk kind of sweep. But let me know and I'll throw the poll up in a few minutes for initial reactions.
Is there just the 4, Jim? Is that, because it seemed like there was more on the email.
Well, no, there's a black and white version, and then no, there was really 2 major concepts that we were looking at: the tree trunk with the leaves concept, and then a heart with the hands kind of concept. Those are the real 2 that we kind of honed in on.
Jim, do you have the second version where they changed the font color,
Yeah, let me
and
one
maybe
second.
increased the font size? I think this was the first iteration, and
This
then
one, okay, here it is.
yeah.
Where?
I don't see it yet.
Oh, let me do a total stop share. Let me try it again. Where was it? This one right here. Try that.
Yeah, that was it, because when we reviewed it, we wanted the font of Public Health Collaborative to be a little bit bigger.
So isn't A on this page the same?
Yeah.
Right.
Yeah.
So one could still vote on the original thing as the poll has been set up and make the recommendation that the Southern Berkshire or the Public Health Collaborative words be enlarged.
Why don't I pull up the original concept first, do a poll, and then why don't I do that first? Because this is sort of like honed in on one specific setup
Right.
versus the other one's more of a general. Let me just do this again. I don't know if I can do the poll with a screen share though.
So make a note of which you prefer.
Jane, I'm going to make you a co-host and see if you can, and at the bottom of the thing, you'll see a poll. You might be able to launch poll. I can't do 2 at the same time with the screen share.
Okay. Oh,
See if
there it
that
is.
works.
Okay, so yeah. So should I launch?
Yeah, try,
Yes.
see what happens. It's the
All
first
right,
time
so-
doing it.
Great. There it is.
Okay.
So please vote and submit. Is
All
everyone
right,
voted?
and I think Jim and I can't vote because we're the ones that are polling, so
Okay, so just,
Add
so it
yourself.
looks like we're between 1 and 3 with that.
great,
So.
okay. That gets us a step forward.
All right.
Definitely between 1 and 3. Okay, terrific.
So I'm happy to share what I feel with the two. Is that what we should do, is like have conversation of what we liked and how do we want to do this?
I would like to settle this today if we can, but it's
Mhm.
also 10 o'clock and we have a few more things to go over. So I'd
Mhm.
like us not to be too expansive on this, but please, those who have a view on how to improve or what you're thinking of, why you chose one, go ahead.
So if I were gonna be, oh, Ellie's had her hand up for a while.
No, I was worried about being able to use the poll. Yeah, I like the idea of the people supporting the tree rather than a hand, because
Mhm.
it's like all of us. It's not,
Mm.
we're not, we're not just lifting people up. We're like helping them and growing with them, and it's a
Yeah.
person thing.
Hmm.
I'd like to see the bottom line in number 3 centered. That's just me.
And perhaps enlarged a bit.
And enlarged, yeah. Yeah.
That was my thing, is like, I felt like, I like the public health collaborative, is the most descriptive part of it. Like, all of the words are description. Southern Berkshire are descriptive, but the public health and then the collaborative are also important. So, a little bit bigger. The other page that got shown with the public health collaborative was in the right direction as far as that goes. But I like the first one just because it's so symmetrical, and I like symmetry.
Mm.
I'm a symmetry person, but that's my thoughts.
Any other comments, please?
I'd
Kai,
like to make a comment. I like all the printing on number 1 put into number 3, excuse me. I think Southern Berkshire is darker and hits you better, and I like the capital letters, the public health collaborative. I like the idea. I originally voted for number 1, but I like the idea that you said people, and I think that's better. But I don't like the Southern Berkshire. It seems kind of in number 3, because it seems kind of pale.
okay.
Yeah.
Other comments? Diane,
I agree with what she just said. I feel like number 3, Berkshire kind of fades out. You see,
Yeah.
Southern, it doesn't grab you. And if you're going to look at something once, you want to have it really capture where number 1 sort of does that. I wish the public health collaborative on number 1 was just a tiny bit bigger, so
Yep.
people would realize that it's a collaborative. I mean, it's just a matter of what you focus on. That's it.
right, Jill, did you have your hand up?
I did. Can you bring up the other ones, the ABCD page? I like C better.
Yeah, what I was going to say to you, everyone, is that if you're interested in concept 3, we retooled multiple options for number 3 with font changes. Hold on, right there.
I
Okay.
liked C the best.
Yeah.
I'm just thinking of monogramming. It's, I don't know. That's just how I think. I think the Southern Berkshire and then the public health collaborative, like for A, it's like, it's too, I don't know, it's too much. It's too long. But I like C better.
I think I like D better because it's darker, and all the letters are in the same, both font and color. I think when we go to that kind of light green or whatever you would call that, sage color, it fades.
Mm.
Or it could be gold. The collaborative could be gold.
I
like it all together.
I would recommend from the graphic work that I did was that you not change too many colors in public health collaborative. Because I
Right.
agree, the darker is better and it's distracting. And for me, my only difference with D would be to center the word collaborative.
So if I can weigh in for a moment as well, I think if we look at C, take Ellie's advice and keep the color of the words consistent, perhaps that of the public health
Mhm,
words, enlarge Southern Berkshire,
mhm.
possibly to match the length, the size of the text
Yep.
in collaborative, although it won't fit. So I think it's going to have to be somewhat smaller, but certainly bigger than it is now. Could we go with that as an option?
Yes.
Mm,
I'm taking
I like
notes.
that.
I'm taking notes. So we would want, so for C, we would want to, so the font and colors can be whatever we want it to be. That's an easy lift. It's the concept that's the challenge that we want to, be consistent with, because we went through multiple versions of font sizes and whatnot. So we would want to enlarge Southern Berkshire and length to match under public health, size and match. Are we okay with the colors with number C?
No, it would all be
No.
one color, that of the words
Yes.
public health.
Public health.
So Southern Berkshire Public
Public
Health,
health collaborative, all of that, I think should
One
be
color.
one color.
one color.
Yeah.
And Southern Berkshire too.
Yeah.
Yeah,
all one
It'll
color.
just be smaller.
Do we want Southern Berkshire to match the size of Public Health Collaborative or just be a little bit smaller?
I think
I think it has to be as big as it can be within the length of public health.
Gotcha.
Right, and you can kern the letters. You have somebody doing this who knows this. You can you can squinch public health together a little bit, center collaborative, and then enlarge Southern Berkshire to kind of blend in with it. I think Southern Berkshire is important, so I think it deserves a little bit bigger.
Mm,
But you
Okay,
can
so
do a lot
now-
with kerning the letters and adjusting the spaces and graphics, so
Right.
make it.
Now there are three colors there.
Yeah,
One
and I
person
think
blue, one green, and then the color of the leaves. The blue does not get used again. Is there any suggestion? It had been used for the Southern Berkshire phrase, but we want it more to be all in one color. Is that correct now?
Does that make us kind of go more towards D altogether?
More toward what?
D, we've been
Oh.
working on C, but D has just I think it just has two colors. And I'm not crazy about the kind of sage color.
No,
I
I
don't-
think the other D is wimpy. I think
I like the colors of one
one.
Okay.
Going back.
from the previous one.
going
Oh.
back.
All right, so here's the question. To move this along, we could spend a lot of time. I think we understand the sentiments. Would you trust Rebecca, Jim, and myself to take those suggestions and come up with a final and go with it?
Most definitely.
Yes,
Sure.
Yes.
Okay, great. Thank you very
I'd
much.
like to make a motion that we allow that.
Second, yeah, go for it.
Any discussion on that?
Let's not.
Let's not. Okay, good. Thank you all
Aye.
very much.
Thank you. This was
Great
great
job.
work, guys.
And we're all going to get T-shirts and baseball hats and whatever.
Excellent.
Okay, member discussion items. Are there any issues you want to bring up? Anything you want to remember for the next meeting to go on the agenda? Jim?
Yeah, the only thing I want to just quickly bring up is I did send to all 10 member towns the equalized valuation proposed budget. There's two tabs. One, so what we did is we met with Sheffield Monday and I spoke to Scott and certain other ones. So what we did is, we've all been communicating that as we build our flu program, for example, there's going to be some startup costs for purchase of private vaccine. And then over time, it'll become a sustainable program. So those kind of costs aren't allowed in the shared services grant. So it's one of those things where, initially we said, oh, towns had VNA money. What are we going to do with it? Some towns started to begin to repurpose that to training and others. But as the VNA pulled out and Amy, Jill, and myself started thinking about what it's going to take to get this program up and running, we had to buy equipment, for example. We had to buy certified coolers. And the best way to kind of share those costs is through the Equalized valuation system, which is similar in that of the household hazardous waste, where it reduces the inequities of asking towns for certain money. So there's two tabs. One is the equipment breakdown. The second one is proposed cost for vaccine based on 900 doses. Now, it can be less, it can be more. And it's just, we don't need to get deep into that, but like I was telling Scott and Pat and others, it's, we don't want to go back to the select boards in the town and say, this is our requirement, but I think there's a recognition that if we want to build a sustainable flu program, there's going to be some cost to kind of get us up and running. And hopefully over time, as we start to get the billing and the reimbursement piece back, and we may not need as much to keep us going. And so those are the thoughts and ideas. And I know a good chunk of the towns have already said, yes, just, tell me what my cost is for my piece of the puzzle for, the equipment, and, tell me what I need to do for, for flu purchase. And, as things settle down, we have all the equipment, that's all set. I know Amy and Jill, and then when Jane starts, is going to try to wrap up the final pieces through MIIS and color and try to figure out the billing. And we feel really confident we'll be ready to roll on a flu program, when things settle down a little bit. And it's just, take a look at it. If you have specific questions, give me a call, then we can figure out what the next steps are. It's just, I had never realized that flu vaccine is like super expensive. But, for those that we can bill for insurance, we're going to get that back to sustain the program further down the road.
Jim, quick question. So I missed the second tab, vaccines. That was my one question. So the purchase is like 6,900 and the vaccines is 26,500. That's the total for those 900 doses.
Yeah. So what we've done is, so Amy and Jill got prices through certain vendors on what like a low dose would cost, a child dose, and then a high dose. And we just, preliminary plug those numbers in. And then we just estimated, we may have to buy sharps containers, for example, gloves. We just added a cost center to that just to give us a little bit of buffer for that. And, we don't even know if 900 doses is going to be enough. And what I was telling Pat and others is what's been frustrating for me is like trying to get an analysis of like what the VNAs had done for their contract towns over the years.
Yeah.
No one knows. And so like we're taking a stab at like what it's but if we want to do the schools, for example, and the senior centers and certain other groups, 900 may not be enough.
Yeah.
But it's sort of just like a starting point. And again, I want to emphasize the second tab. We haven't purchased vaccines yet. That's sort of like what we're thinking initially, and that's what Amy and Jill had mentioned to me. But like we can't administer 5,000 doses of vaccine the first year that we do this. I think we should get up and running, kind of focus on those groups that we need to do, and then we can grow from there.
Ellie, you had your hand up?
As long as I don't have to have lawn signs to announce this, apparently Mount Washington is okay going with it. But they'll kick up about lawn signs.
We'll avoid that. We'll avoid that.
Please, thank you.
Okay. Any other comments on this as an information item? Okay. Does anyone else have any items to bring up?
Pat, was there something you wanted to bring up when you and I first talked?
There was. It had, what, wait a minute. Let me go back and look at my calendar, which is where the note was. Oh, about contact tracing and dropping that and compensating for that activity, something, I don't know what that was about. I think we can just forget that piece. No, don't know what it was, sorry. Can't read.
Yeah, Madam Chair, and Mike Hugo from MHAB just joined. I wasn't sure if Mike, we're almost wrapping up, and I'm not sure if you had specific questions or looking for anything joining the meeting.
I apologize. I was on another Zoom that was supposed to have been 30 minutes starting at 9 and it just got done. I apologize. So no.
Well, we already
I'll
discussed
catch
the
up.
IMA. We're gonna be moving the IMA to some of the town councils for review. A couple towns have already sent some comments, but so far nothing earth shattering. I'm gonna be moving the IMA because Lee is the host community for the grant. We're gonna be moving that to the select board on February 1st and then try to work our way through that.
Okay.
And
Anything-
just to add to that, Jim, starting in February, I will be available to help with some of the load if you need someone to help present or, interface with the board. I just wanted to throw that out there.
Thank you, Jane. Good. Any other comments or questions under member discussion?
Yeah, quick question, Jim, on the spreadsheet on the flu stuff. That's based on property values, not necessarily population.
No, it's not population. So equalized vet. So when you do a population model, it creates a lot of inequities when it comes to public services per se. So you can be a community with a higher population, but like less resources. And what we found over the years, even this happened true with Tri-Town when we were on the population model. Lee was paying more on population, but getting less services. And so when the household hazardous waste was almost left for dead, actually Sheffield, Great Barrington, and Tri-Town got together and we decided to do the equalized valuation system, which takes in consideration property values, land valuations, growth. It's a whole DOR assessment that we kind of plug in. It's previous fiscal year numbers. And so what we do is it spits out your percent of the whole. And that's been working really, really well. And, because you can have a small town that is paying more than the services that they're getting. And it's an easier balance. And that's the best way I can figure out how to do this, because one town A is really large, but they don't have a lot of wealth. And so it's more of a struggle for them to pay more than other towns that may have a smaller population, but have a lot more capital. And so that's a good way of delivering services. And it's worked for us for many years, because the way the collaborative is set up now is we're not doing 20% Sheffield for nursing, 10%. It's we're doing everything, whatever the services are needed, we just gravitate towards that. So we can't be specific by population. This is the only way to do this. And I think it's a fair way of doing it. And I think more public services should go with this, because it's just, and the percentages really don't change over time. What I've seen with the household hazardous waste, wealth kind of trickles up and trickles down depending on what's going on in a town, but it's pretty consistent across the board. And it's really worked well with the household hazardous waste, and people are more happy with that assessment versus the population.
Yeah, no, great, thanks.
Great. I have two final questions. I want to know what Diane's button says and what Amy's t-shirt says.
It's not,
Wait, you're muted.
yeah, it's not a button. It was from Ireland. It's just wool. It's just different strands of wool.
All right. And Amy, what does your t-shirt say? It says let something.
She's left-handed, so maybe it's just LFT for left.
All right. Sorry.
It's let love in. I was transitioning to my car to go make a meeting, but let love in. Trying to send good energy out right now.
Great. Thank you. I appreciate that. Sorry, tried to end on a good note. The next meeting is February 11th, probably also at 9 o'clock. If you have items for the agenda, things you want discussed, please let Jim or me know. It will be important that we cover these things in a way that we are prepared to do so. So it would be great to have your input. Any other final comments? If not, a motion to adjourn.
Second,
Oh, all right. I guess I made that. Good. Thank you. Any discussion on adjourning? All right, great. All those in favor, please raise your hand. We're all visible here. Terrific. Thank you very much.